Good evening, everyone. Today we're going to continue our series of conversation on this research process. There's this timetable that usually drive our activity, even though that we build our activity to be beyond this scope. Give me 1 second. Even though we build our activities to be beyond this scope, but this timetable usually drive majority of what we do. My name is Dr. Kobe. I'm one of the pioneers of this group, and we're going to be talking today on data, on how to get data. And then subsequently, we'll go into details on how to actually extract this data and analyze it. And then we'll go over how to generate theories of how do you determine what you want to do with this data? How do you determine how to match pair it? How do you determine the variables? And we're going to get several experts to talk about different things. Because of the nature in which we try to simplify things, we're not going to cramp everything in one topic. We're just going to go in like 10 minutes in detail of one. So the introduction of this is, where do these data lie? Where are all of them? Like, how do I get data for my paper, for my research? What do we do? That's the major thing that we're going to discuss today. So I had this little 5-slide thing. This question that usually comes around this time. People want to get research for different reasons. They want to get research for majorly their residency application to, add to their profile that, hey, I'm a scientist, I can do this, I can take care of people, I reason rationally, and I can analyze things. Another reason is for their PhD or their master's, or they actually truly interested in finding out either relationship, causality, or they want to find out trend sequence, or they want to find out dissociations or associations or patterns. Or these words, I chose them carefully because in doing research, especially the very easy research, which if there's any word like that, you want to do the simple things. And these are like the baby steps of research. You want to find out a pattern. Is it increasing? Is it getting worse? Is it getting better? You want to find an association. Is age related to diabetes? Is diabetes related? So is age related to early death in diabetes? Is smoking related to whatever, skin cancer? Is non-compliance related to hypertension? It's there's so many common myths that we come across. For example, let me think of anybody can give me any common example. Any relationship example that you've been bothered about, and you can unmute and you can talk. Let's say someone has a CVA, all right? Should I, let's say subacute CVA or chronic CVA, am I going to give anticoagulants? Is it related to worsening, is it going to worsen it if it's ischemic stroke or hemorrhagic stroke? A very common one. Someone has head trauma, an elderly person has head trauma, they'll tell the person to, let's observe it for 24 hours and repeat CT after 24 hours. What is the statistical implication or clinical implication as to that repeat CT? Is it really necessary to do? And then we'll look over the trends of people who have had head CT, who have had head trauma, had their initial CT, and then after 24 hours or 48 hours, they repeated the CT. So, okay, what was the average findings in this CT? Not only that, data cut across so many other things. You could look at relationship in between depression and rehospitalization, for example. How many times what are the factors that associate or are related to depression and why they come back rehospitalized? What are the factors that affect rapid improvement in after surgery, 24 hours post surgery, and so on and so forth. What is a new rate of uh, sexually transmitted disease in Cook County or in Miami County or whatever? So for you to do this analysis, you can either choose to do it in several formats, right? You can choose to do it in, I want to do primary analysis. I want to do it primarily to get this data primarily. That means you have to either choose to use the interventional style, which is you set out your preclinical, clinical trial, phase 1, phase 2, phase 3, to actually extract this data, right? And then use that data and analyze it and see the relationship. For example, I want to see the rate at which chemotherapy or phototherapy or immunotherapy using ipilimumab, right, helps with skin cancer or submucosal cancers, for example, mucosal cancers, whatever, or stage 4 metastatic cancers. And I want to say if this drug X is going to be effective on this. And then you set out to do that, and then you have a control group, and you have all those designs. So those are primary data. To bring it more closer home, I've had this question several times. How do I get data to analyze? How do I go about it? Just remember that you can literally analyze, smoking factor is a risk factor for cancer, for example. You can literally analyze anything. So we try to keep it simple in our academy. We try to make everyone to do what is close to you. Don't look at Dr. Helen, who's running at jet speed, or Dr. Edwards, who's running at jet. Do something that is very close to you. You can literally analyze 10 things and publish it. Just keep it so simple, so simple. If you cross the baby step, you move to the next. You can literally analyze 50 things, right? And then before you begin to look into the complex things. So primary data, for example, within our group, we're close to like 600 plus. You can pull a research on that group, basic understanding of research processes within physicians trying to get into US. That's a research question, for example. And then you design your questionnaire, and then you collect data from, I'm sure you're going to get over 100 responses. And then you collect data, right? Those are called primary data. So I'll give you 2 examples of primary data. Another primary data, like one I remembered what we did, we wanted to see the effect of malaria on depression. Well, that was one of my very first preclinical data research that we did. So we took, in preclinical studies, we took specialized mice and injected malaria in them after all the processes of research, approval, and all the rest. And then we hung those mice upside down using tail hanging technique. And then we measured, first of all, the malaria load in each mice, and then the activity of the post-hanging techniques. So we use that activity, the way they were restless or non-restless, to determine if they were depressed or not after specific timing in that research. I did that research with Dr. Kenneth Okoje. It was a very simple thing that we did to determine the relationship between malaria and depression, right? So we measure the activity and then the malaria load for each of those mice across different days. So, and then we wrote our paper. When we designed that study, the professor that was supervising was like, wow, this is so cool and very easy. Yeah, it was very cool, very easy. Something we did like over 7 days, right? And then we wrote our paper. We've already gone through how to write this basic structural paper. So you too can design your own primary research and get your data. Now, the caveat is if you're applying for September cycle, this 2025 cycle, from my experience, between now and September, not March, it's really very crammed up to do something that you're going to publish, except you're making up your mind not to publish that, right? But it's too short. Before you go through IRB approvals, that's going to take out like 2 months. And then you go through, creating your data, doing your primary survey, and then validating your data, your primary design, and then, moving on to other things about the data, and then working with the statistician. Very, very important in designing or collecting data for primary studies. Primary studies are studies that have not been published anywhere before, right? It's very important that you work with statisticians, because those statisticians, truth is that no matter how knowledgeable you are as a doctor, no matter how knowledgeable I am as a doctor or as a researcher, I'm not as knowledgeable, or I may not, the word is, may not be as knowledgeable as this statistician who is like their full-time job, day in, day out. So in this academy, I keep and I always advise our students or our co-researchers to look for someone who you can partner with and, walk along the fine thread of the needle with the person, especially from day one that you're trying to conceptualize your research concept. And we have statisticians in-house in this academy that can actually work with us. We also added another one today, who can actually work with people. They charge for their services. Like I usually say, these services are not free because they're intellectual work. But if you can also, go to the YouTube of University of YouTube, I usually say there's tons of data, tons of videos on how to design and collect primary data around wherever you work. Also hitting it at home, make use of where you are. If you're in the hospital, or if you're currently working either in Saudi Arabia, or you're in India, or you're in Ghana, and you truly want to get out research, primary data, utilize where you are. If you are an anesthetics in the OR, utilize your OR table and see, you could do very simple things, simple research designs like the rate of recovery using one ketamine agent or one agent versus another agent, for example, or the time of recovery. And then you do that, so you do that study, and that's going to be beautiful. Novel, right? Or not novel. Even if it's not novel, they've done it before. They've done the rate of recovery from, let's say, propofol, or you're using inhalational agents, right? And they've reported it in China, or you are doing it in your Ghanaian population base. And you might not necessarily do the 100 population data. If you want, you could do 20 and start from there. You call it your preliminary data. You say your preliminary data came out 20 and it showed this significance. So now the next phase is now to expand the power of the study. So you say, okay, yeah, so to do this thing, to time it. Yeah, to do this thing, to time this thing is easy, and to do it is fine. And then you keep going on with it. So those are primary data. But because the time is too short for those who are applying for the electronic residency application, I pulled out electronic residency application timeline here. I don't know if I can still see it. But if you see that the season has opened, and then by September 4, you're supposed to start submitting, and then by September 25th, the people who are supposed to, the programs are receiving your application probably by September 30th or October 1st. Most programs are sending out interview. First week of October to the midweek of October to last week of October, first week of November. A lot of people are getting interviewed between October, and then people are getting interviewed based on, a lot of factors that we're probably going to discuss in the ordinary session today by 7:30. All right. So that timeline is too short, and that's why you see us now focusing on literature review, something that you can go online and get data. That brings us to the talk on secondary data. So if they have previously published it, you can use them as secondary data, right? There are various data sources depending on what you want to do. And don't overthink it. These data sources are as available as you think it. Just go online, type data source in Miami-Dade for tuberculosis. Before you do 3-4 browsers, you're going to see a database. And trust this government that we live in. In these United States, things work very well. They organize data so well that you'll be surprised. You'll be surprised on the amount of data that is available online, right? But there are common secondary data that that are available. Start from very simple ones, like in your hospital, for example. Data has been collected on several things. If you ask your quality departments, you will notice that they have data on death rates, on mortality rate, on admission rates, on the rate of hypertension, number of hypertensives, number of people who died from stroke, number of stroke alerts they received, number of IV fluid on these stroke alerts, number of the temperature logs for this stroke, for these people that had this code sepsis. And let's think of anything around the number of foods, diabetic foods, and the relationship to their blood sugar, rhabdomyolysis, and relationship to renal failure. For example, you want to figure out, okay, at what level of CK or creatinine, what they call CK, whatever you call it, CK, does renal shutdown begin, and how long does it take before this rhabdomyolysis will lead to renal shutdown? Because we often hear that rhabdomyolysis. So these concepts are coming to my head as we speak these things, right? And most of the time, they come from your daily experience. We just admitted someone with rhabdomyolysis, and one of the quite key questions is how long does this take for this patient to develop a renal disease or acute kidney failure, and why? Are there other whole factors that will lead to acute renal disease or acute renal shutdown because of this rhabdomyolysis? Right. And if you want to do that, you could start from simple case report, which is like secondary data, or you could do a case series. So you get like all the people who have rhabdomyolysis over the past 1 year and see what was the level at which we admitted them, and what was done, and then what was their renal function at admission and post-admission, and how long did it take for the CK or CPK, creatinine kinase or CPK to reduce, right? I'm giving a typical example. And then you plot the relationship graph. You use following your either simple relationship graph, or use a statistician and say, okay, this person received 2-liter fluids, or this ones didn't receive 2-liter fluid. Within 24 hours, the next lab came back to be maybe creatinine elevated, BUN elevated, GFR, whatever affected, and so on and so on, right? And then you do that relationship. It's beautiful concept that we can actually do in this group that just came to my head. And then you will be able to say, make a very good publication or announce it to your scientific group that, hey, I think if a patient comes with elevated CK, usually greater than 6,000, if left for 2 hours without attendance or whatever, they may have AKI based on our research done by Okobi and Rita et al. Right? Beautiful information. So that's source of secondary data. If you are not working in the hospital and also you're interested in public health data, there are tons of public health data that are available for us. I was just trying to create a concept for some papers that we're writing, and I was just looking at where we live in Florida. We live in South Miami, called Miami-Dade. That's Miami and all the neighborhood, and there's a shit ton of drug addiction, STIs, and other things that's happening here without throwing shade, which is also common problem around the US. I love my state. I love Miami. I'm a proud, I'll not use the word citizen, resident of this place. So I don't want to down talk them because I know this is on record, but there are a lot of things happening in different places. And I was just thinking, okay, how can I get data? Yeah, behold and lo, we went online and I came across this data source, Florida Health Charts. Wow, amazing. I never even knew there was something like that, right? And I started studying it, and I saw, tons of data. Let me see where I kept that data. Tons of data on give me 1 second. I saw tons of data on in Florida, right? And it's so cool how to navigate them and how to understand it. That you can also do similarly in your states, wherever you are, and in those programs that you want to apply, because we are, using we're trying to be very smart in whatever we do, right? So you can apply that in your states, Florida chat reports, right? So this is where it is. That's give me 1 second. I need to show. Yeah, Florida chat reports, right? And it's so easy to use. If, for example, you want to you look at something around between 2000 and 2000, whatever, June, and then 2004, the same thing between 2000 and 2020 and 2024. I want to look at the rate of, let's just say, in what county I live in Miami-Dade, and then in what disease spectrum, maybe drug abuse or whatever disease we're going to choose, check all. You can also check or pull up all the data. Let's just say pull up all the data, for example. You want to know diagnosis, already that confirmed diagnosis, that's what I want. And then acquired status, they were acquired outside Florida or within Florida, whatever, outside the United States, acquired in Florida, for example, just using Florida, for example. And then age grade, what age grade do I want to study? And then let's say I want to study, around my age grade, let's say I'm between 10 and 14, right? That's where how old I am in this particular stuff. So before you do this, we've had several videos that talked about methodology, study designs, and how to go about study design. So this is, if you see me doing this, I'm actually playing a methodology in my head, right, for me to get to this particular point. And then I click on submit. It's going to pull up the data, right? And this is the data source. And then the next thing for me to do is to download this data, depending on what I want to download, and impute it into my statistical analyzer, because you're not going to do it by your head. There are ways to analyze this data using statistics. Either you're using SAS, you're using Stata, you're using SPSS, or you're using even what they call it, Excel sheets, right? So these actual analysis we're not going to cover in this particular video. In the next video, we're going to go into how to extract this data. If you download it, it's going to download as a file, either as a different formats in files. I'll probably download as hold on, these my files as different from 5 formats, basically. We'll have a video on that will go into step by step on how you extract this data from this website. It's a typical example, this website that I just showed. And then you impute it into your statistical software. And then you give the command depending on what you want to do. To study each statistical software is also something we're going to do. We're going to go through each of the statistical software, SAS, Strata, SPSS, and all Tableau and all whatnot to discuss the details. This data that I just did in Florida chat, for example, is available in New York. It's available in California. I'm just looking at one also, the California, where is it? And this is enhanced. Yeah, this California Disease Surveillance and Research Branch. It's available in California. It's available in everywhere. You can decide to merge different states and then do whatever type of write-up you want to do, right? I was discussing with a friend of mine. Sometimes this particular part of it, for me, if it's going to get too hectic, I sublet it to the statisticians and say, hey, I have this data, analyze it. This is what I'm looking for. This is my objective. And then they're going to discuss they're going to plan what they call the statistical design. And then they do the analysis, do the relationship or the strength of confidences that you want to do, or the dissociations or the deviations that you're looking for. And then eventually, then you write on it, right? And to write on it, we've had several videos again that has taught us on how to write on it. But those are not the those are not the focus of this particular presentation. The presentation is sources of data. Other sources of data. Very, very simple one. We just type CDC Wonder. I think I've shown this one before. CDC Wonder is something I use a whole lot. So many things that you want to do on it. These are all data sets. Births, deaths, multiple cause of death, different. So this CDC data, CDC data is focused, CDC Wonder mostly focus on mortality and morbidity, right? And I think we showed this one certain time, let's say cancer statistics, for example. And it's important, this thing, because we're not going to babysit anybody to go into, step, take your time and read them. Almost everything here, if you click it, it's probably going to take you to somewhere you don't know, somewhere you know. Take your time and read them and figure out what you're actually trying to study or trying to do. And then you get to the actual data source. Most of the time, sometimes they will require you to have an access to pay, like some of the CDC, NHIS survey data, which everybody know where it is. And some of the time they are free. These are free ones that you can use to do your research. Let's say I want to do common childhood cancers, for example, and leading cause of cancer sites or cancer site, common childhood cancers and their sites. And then I want to see them in states, and then I want to see them in years or age group or whatever, right? And at the end of the day, just follow all these prompts between this year. You have to have also a little knowledge on how to use your computer, because what I just did now, if I start clicking them individually, it's going to click individually. That means I'm going to be extracting individually. If I use Control Shift, I will be able to run between like 1999 and 2006. Same thing with this one, right? So just some basic computer skills that you may also know I need for both of them, male and female, and then what age group and whatnot. And I keep going down, just keep following the whole thing. At the end of the day, you're going to send for requests, and it's going to generate the actual data file for you. Once it generates the actual data file for you, age group, cancer, you must also select childhood. If you don't do it correctly, it's going to give you some errors, and then you look at what errors that it gave you, and you eventually pull up that data file. When you pull up that data file, you download it, and then you export it into your statistical software, and then you do your extractions. Very simple, straightforward. These are free data sites. And also the enhanced data website is also there. For example, CDC can copy this link if you want to copy, but it's easy to find. You just type CDC enhanced data set, CDC enhanced data sets. And then you're going to see these data questionnaires are set in different years and in different times. You want to do association between 1 and 2 or 3 or 4 or 5 of them. You take them one after another. In here, data set stopped in 2020. The next one that we're expecting is 2020, 2021, 2022. So these are free data sets that you can use. And then there are also paid data sets, numerous, so many of them that you can utilize in your data sets to get what you want. We've already talked about like scientific literatures. We talked about the PubMed, where you could get the enhanced, the Cochrane studies. Those were talked about in different videos, right? And then very importantly, biobanks for those like pathology, right? For those that are in pathology, they can actually utilize a lot of biobanks to look at either what happened. A very interesting study a friend was discussing with me some few days back was on the patterns of long findings, pathological long findings in COVID-19, right? Because we hear that there are so many different, COVID-19 threw up a lot of, give me 1 second. So 1 second. COVID-19 threw up a lot of uncertainties. The kidneys were shutting down, the lungs were shutting down, organ failure. I think somebody came down with Bell's palsy, and then there were a lot of pathology reports, that were done during this period. Um, Genomic studies and the rest. So there are so many biobanks available for those pathologic studies and genomic studies that you can actually go online, and then um, you're going to see lots of them, right? And then the bottom line is pull the data, download it, and then you can analyze it using any of the software that you are used to. But today's discussion is not going to focus on those softwares, or not those softwares, and how to use them and how to use them, because that's a long talk. We will quickly go into the second part of the conversation. So these are available data sets. Like I said when I was starting, it's a high-level overview. It's not intended to go into the details of each of them. However, remember ethical considerations whenever you're doing them. If you're going to extract data from your EHR, remember ethical consideration. If you're going to look at the patterns of pathological findings of all the colonoscopies, let's say you're going to GI studies, for example, you're looking at pathological studies of all the colonoscopies done within the past 2 years in my center. What is the rate of pathology, for example? Rate and incidence studies prevalence and incidence studies are very easy to do and easy to write. You find tons of paper on them because it's easy to say, okay, this one was higher than this one was higher than this one, right? And so you can do that, but before you do that, you have to get permission from the hospital ethics committee or from your department. Don't forget to protect your patient's right at all time, patient's privacy at all time, whether you're doing research with other people, you're not doing research. And data security is something we're very cautious before we add you to this group, because we know that we share a lot of data, papers are flying. We don't want someone stealing our ideas or stealing our paper or stealing one thing or another, right? So we kind of go into, we kind of heavy on whenever you're doing these things, you're sharing people's confidential information, somebody's pathology report, somebody's colonoscopy report, somebody's sexual history, right? That might go back and haunt the person. So don't forget to do that. We've covered a high-level overview. I'll repeat it again, high-level overview. The next series of sessions, please, we want you to stay with us while we're going to take one of those data sets, one of those data bank after another. You'll see how we navigate straight to that data, where the data is, extract the data, impute it into the software, or generate the theories around the software, or generate the commands around the software, depending on, and then we're going to handle one software over another, one software over another, one software over another. And hopefully before the plan is before June, July ending, we should have covered, we have 4 classes in July ending. In July ending, we should have covered at least somewhere significant enough for you to have, being proficient enough to do this by yourself by the end of July ending. However, the caveat I usually take is people also want to build skyscrapers in one day. It's going to take years of listening to these things and then trying it out yourself and then asking questions and trying it out yourself and asking questions before you can build it. That's for those that are interested in national surveys and national data. Whatever research you do, whether it's national survey, national data, it's going to be helpful ultimately in your career, either your residency career or your non-residency career, right? So demystify or defocus on it has to be one big national data, right? So what? This person could be doing his literature review, fine. Okay, so this person could be doing his case report, okay, fine. So what is important is just keep going, keep moving, whether you're doing it in this group, whether you're using us as a focus group, whether you're using people around you, whether you're using your family, whether you're using your friends as focus group, just do something. Where it becomes difficult is when you think that this is the only one way to get this thing done. And I've seen it happen to so many people over and over. This is the only one way to get this thing done, and then you don't do it. My wife told me the only way, in conclusion, the only way to learn how to write is not to listen to people who say how to write, like listen to me, is to sit down and actually write. I don't know if she's here listening, but she told me that one time when I started this whole journey. It's not to listen to people who say this is how to write, but actually put your hand, because the more you write, the more the muscle memory, the more you type, the more the muscle memory and the experiences come. And then you're able to type one paragraph of research based on everything that you have done. That becomes, wow, I did it. And then you add another paragraph, and then you add another paragraph, and then you add another paragraph. This is IMG Research Academy. In IMG Research Academy, our focus is to demystify research, where all physicians or near physicians or either post-physicians or people who want to be like us, researchers, running through this race to get into the next level of our career. Majority of us are applying for residency, and this group has produced high profile, high functioning physicians currently. We've been able to produce over 8 chief residents from this particular group, and counting on so many people who are on the pipeline, and those who have graduated and gone into fellowship. Thank you and God bless. I'll stop the recording here. We want to discuss something that has been a burning issue over